Hello everyone. So this is our 10th lecture on social issues, and in this lecture we will be talking about issues relating to development and management of social sector services mainly. And in those social sector services we will be taking up your topic of about health and education. That is the health and the education scenario in India, and what are the bottlenecks, what are the problems, and what are the remedies or solutions to strengthen the healthcare system and the education system in India. So let's begin with the lecture. First of all, before taking this topic, you must know what is the simple definition of healthcare sector, or what does healthcare sector comprise of. Okay, so healthcare sector, it comprises of your hospitals, medical devices, clinical trials, outsourcing, telemedicine, medical tourism. So if you talk of improving healthcare sector in India, then you have to take care of all these sectors. Okay, you have to take care of improving hospitals also, medical devices also, clinical trials also, medical tourism also. You have to promote if you are concentrating on improving healthcare sector. हेल्थ इंश्योरेंस पे भी काम करना पड़ेगा, मेडिकल इक्विपमेंट पे भी काम करना पड़ेगा. तो इस तरीके से सारी चीज़ों पे. द इंडियन हेल्थ केयर सेक्टर इज ग्रोइंग एट अ ब्रिस्क पेस ड्यू टू इट्स स्ट्रेंथनिंग कवरेज, services, and increasing expenditure by the public as well as private players. So Indian healthcare sector is growing at a very fast pace. Why? Because both the public and well as the private players are increasing their services and expenditure in the healthcare sector. So public sector would include the government, जो भी गवर्नमेंट अपने पार्ट पे करती है, एंड प्राइवेट प्लेयर्स आर दी इंडिविजुअल ओनर्स जो होते हैं हॉस्पिटल्स के या हेल्थ केयर सेक्टर के. बिकॉज वी नो दैट पब्लिक हॉस्पिटल्स या गवर्नमेंट हॉस्पिटल्स भी होते हैं एंड प्राइवेट हॉस्पिटल्स भी हैं in the healthcare sector. So there are private players also and public players also who are increasing their services and increasing their expenditure in the healthcare sector. And this healthcare sector, if you take an overview, it would comprise of all the things: hospitals, medical devices, medical tourism also, health insurance. Everything is comprised under the healthcare sector. Okay, and you must know, you must differentiate that as a developing country, what role should India play to enhance its healthcare sector, and where are we lying at present. हमारा status of healthcare sector इंडिया में overall क्या है, हमने क्या डेवलपमेंट्स किए हैं, क्या एडवांसमेंट्स किए हैं हेल्थ केयर सेक्टर में, और कौन से इम्प्रूवमेंट्स कर रहे हैं हमें हेल्थ केयर सेक्टर में. ये पूरे इशू को हम देखेंगे. अब बेसिकली जो हेल्थ केयर एंड एजुकेशन होता है उससे रिलेटेड एग्जाम में, लाइक दिस इज अ मेन्स टॉपिक. ओके, and obviously it forms part of your social justice paper 2. It forms part of your social justice paper 2. एंड ये जो आपका टॉपिक है हेल्थ केयर एंड एजुकेशन से रिलेटेड, इससे मेनली करंट से रिलेटेड क्वेश्चंस आते हैं. बट यू मस्ट नो द कॉन्सेप्ट्स बिहाइंड हेल्थ केयर एंड एजुकेशन ऑल्सो, बिकॉज एनी आंसर दैट यू आर राइटिंग, इवन इफ इट इज अ करंट oriented topic, current affairs oriented topic, but you need basic static knowledge behind it to answer the question nicely. So that is why these basics are very important, whether it is related to healthcare or education or globalization. जो भी हमने topics cover करे हैं इस पूरे social issues and social justice के lecture में, the static concepts are equally important as the current जो developments होती हैं. तो करंट डेवलपमेंट्स में बेसिकली हेल्थ और एजुकेशन में आपको गवर्नमेंट स्कीम्स को फॉलो करना पड़ेगा. आपको गवर्नमेंट स्कीम्स को फॉलो करना पड़ेगा इफ़ यू आर ट्राइंग टू कवर हेल्थ एंड एजुकेशन रिलेटेड डेवलपमेंट्स. then you must cover the government schemes which keep coming on from time to time. अब जो basic government schemes हैं जो recent time पे आई हैं, like the national health policy हो गया, आयुष्मान भारत initiative हो गया, which is related to healthcare sector, we will take a brief look in this lecture about that. But in detail you have to prepare all the government schemes which are in place, functional right now, and they have been functional since बहुत सारे लंबे टाइम से ये बहुत सारी गवर्नमेंट स्कीम्स फंक्शनल हैं. तो उनके प्रोविजंस आपको पता होने चाहिए, बिकॉज दे आर हेल्पफुल इन प्रीलिम्स ऑल्सो एंड इवन इन मेंस द स्कीम्स रिलेटेड क्वेश्चंस आर आस्क्ड. तो बेसिकली हेल्थ केयर एंड एजुकेशन से गवर्नमेंट की स्कीम्स बहुत इंपॉर्टेंट है जो टाइम टाइम पे आती रहती है. एंड अपार्ट फ्रॉम दैट यू मस्ट बी अवेयर ऑफ द स्टैटिक कॉन्सेप्ट्स ऑल्सो. और जो भी हेल्थ केयर रिलेटेड न्यू डेवलपमेंट होती है वो भी आपको फॉलो करनी है. साइंटिफिक डेवलपमेंट है, टेक्नोलॉजिकल डेवलपमेंट है, कोई भी टाइप की डेवलपमेंट है, दैट यू मस्ट बी अवेयर ऑफ as far as this thing is concerned. Okay, so health जो है basically it plays a vital role in ensuring the rights of people and in facilitating social justice. So social justice अगर आपको ensure करना है society में, then you must make sure that each and every section of your society has got access to good health care. And it should not be like that the healthcare access must be dependent on how rich or how poor you are, but every person deserves in our fundamental rights also we have got right to health and a right to healthy life and a dignified life. So obviously what does that mean? That means that whether you are rich or poor, the state should ensure, that is the government should ensure, that health is a basic right which should be available to each and every individual of the country, whether he is poor or he is non-poor or he is belonging to any section of the society, any caste, किसी भी चीज़ को belong करता हो, but healthcare access is a basic necessity. And even in the rural areas or the urban areas जो एक disparity है healthcare access की, वो भी हमें bridge करनी चाहिए, because so you should consider health as a basic right which should be given to the people. Healthcare access provide करने का क्या मतलब है कि if you are suffering from any kind of health disturbance, so you should be able to access treatment for that प्रॉब्लम इन एन ईजियर वे. आपके लिए डिफिकल्ट नहीं होना चाहिए. ये ना हो कि आपके विसिनिटी में या वेदर यू आर लिविंग इन एन अर्बन एरिया और अ टाउन और अ विलेज, एटलीस्ट आपके विसिनिटी में कोई ना कोई एक अच्छा हॉस्पिटल, गवर्नमेंट हॉस्पिटल या प्राइवेट हॉस्पिटल होना चाहिए, या पैरामेडिक स्टाफ्स होने चाहिए, गवर्नमेंट अपॉइंटेड जो वर्कर्स होते हैं हेल्थ केयर वर्कर्स, वो होने चाहिए टू इंक्रीज अवेयरनेस अमंग्स द पीपल कि कहाँ से बेस्ट हेल्थ केयर सर्विसेज को आप एक्सेस कर सकते हो. तो इस तरीके की जो एक हेल्थ की आउटरीच है, जो हेल्थ का जो एक पर्कुलेशन है सोसाइटी में, जो वो बहुत ज़्यादा होना चाहिए, सो दैट एटलीस्ट नो वन इज़ डिवॉइड और डिनाइड ऑफ एनी suitable health care whenever in times of need. So that is why health should be taken or considered as a basic right for the people, and to facilitate social justice for the people, health plays a very vital role. A healthy and a strong India can reap the best from the future world. तो डेवलपमेंट्स जो हुए हैं हेल्थ केयर सेक्टर में, दैट एनहांस द ह्यूमन रिसोर्स एंड दे ऑल्सो ओपन एवेन्यूज फॉर रेवेन्यू एंड एम्प्लॉयमेंट जनरेशन. सो डेवलपमेंट हेल्थ केयर सेक्टर में क्या होते हैं कि ह्यूमन रिसोर्स को एनहांस करते हैं, एंड दे ऑल्सो ओपन एवेन्यूज फॉर रेवेन्यू एंड एम्प्लॉयमेंट जनरेशन. Okay, because obviously if you have a health is wealth, as it is called, health is wealth. So if you will focus on your health, and if the government will provide better healthcare facilities to its people, obviously it could enhance the human resource, and it would open revenue for, it will open avenue for revenue and employment generation. That means that if you are a healthy individual, you would obviously perform better in your life as far as employment opportunities are concerned or earning revenue is concerned, and obviously that will have a positive effect on the economy as a whole. So developments in healthcare sector, enhancement in the development of healthcare sector is very important. Okay, now Indian healthcare delivery system, that is broadly categorized into two components, what, private and public. Okay, जो public delivery system है, it consists of basic healthcare facilities in the form of primary healthcare centers, or as they are called as PHCs. ठीक है, ये जो PHCs होते हैं, ये मेनली क्या होता है, रूरल एरियाज में होते हैं. एंड सेकेंडरी एंड टर्शरी हेल्थ केयर इंस्टीट्यूशंस जो होते हैं, वो आपके की टाउन्स एंड सिटीज़ में हैं. तो मेनली इट कंसिस्ट ऑफ बेसिक हेल्थ केयर फैसिलिटीज़ इन द फॉर्म ऑफ प्राइमरी हेल्थ केयर सेंटर्स. अभी जो प्राइमरी हेल्थ केयर सेंटर्स हैं, ये रूरल एरियाज में हैं. यू वुड नॉट फाइंड PHCs इन द अर्बन एरियाज. एंड ये जो आपको ये बेसिक हेल्थ केयर प्रोवाइड करते हैं. PHCs जो हैं, प्राइमरी हेल्थ केयर सिस्टम्स इन रूरल एरियाज, व्हाट इज़ देयर रोल? Their role is to provide basic healthcare facilities, like for example नॉर्मल फीवर है या नॉर्मल कोई इंजरी है उसके लिए. अब जो हाई लेवल एडवांस डिजीजेज होते हैं, क्रोनिक डिजीजेज होते हैं, लाइफ थ्रेटनिंग डिजीजेज होते हैं, उनके लिए जो प्रॉपर सेकेंडरी एंड टर्शरी हेल्थ केयर प्रोवाइड किया जाता है, वो इंस्टीट्यूशंस की टाउन्स एंड सिटीज़ में ही मिलते हैं. ठीक है, प्राइवेट सेक्टर is the one that primarily caters to secondary, tertiary and the quaternary care. Like you would always see that those specialized hospitals जितने भी हैं, whether they are related to big healthcare प्रॉब्लम्स लाइक यू नो हार्ट ट्रांसप्लांट हो गया, लिवर ट्रांसप्लांट हो गया, इस टाइप के जो एडवांस लेवल के क्रोनिक डिजीजेज होते हैं, उनको मेनली स्पेशलाइज्ड किसने करा है, उनको टैकल करने के लिए प्राइवेट सेक्टर. So that means that government should have to must play more role in enhancing the healthcare facilities. Even government hospitals should be equipped enough to cater to the secondary and tertiary healthcare needs of the people. It must not be like only the public sector should play a role to enhance the healthcare facilities. Even the private sector should come forward, even the public sector or the government should come forward to equip its hospitals in much better way, so that it's not just the mandate of primary sector to cater to the chronic diseases and the secondary care, and the government's role should not just be limited to providing basic healthcare facilities. It should also enhance its presence in curing even the chronic and the other secondary and the tertiary healthcare facilities. So that is the thing over here. Okay, now what is we'll have a look in the Indian healthcare sector data. Like every sector has got related data which shows you the kind of situation related to that sector in India. So public expenditure जो है इंडिया में, that is the amount that is spent by the government on healthcare sector, it remains very low in India, and that is one of the major problems of the Indian healthcare sector, that the sufficient funds are not available. And when there is a shortage of funds in the healthcare sector, obviously it would not perform up to its best level. So the public expenditure on the healthcare, that needs to be increased, which is only about 1.4% of GDP at present. Investment in health research has been very low. If you would not see what is the importance of healthcare research, like for example जो वैक्सीन डेवलपमेंट होता है या अदर काइंड ऑफ बायोटेक्नोलॉजिकल एडवांसमेंट्स होते हैं हेल्थ केयर सेक्टर में, दे आर ऑल डिपेंडेंट ऑन द रिसर्च दैट यू डू, एंड द इन्वेस्टमेंट जो इस हेल्थ रिसर्च में की जाती है, दैट इज़ वेरी लो इन इंडिया, and it is only just 1% of the total public healthcare expenditure. So as it is, public health expenditure is very low, and uska bhi just 1% is allotted to investment in health research, so that should be improved. फिर insurance coverage जो है इंडिया में, that is also very low, and insurance coverage is very important for the poor and the elderly people of India. Okay, and only over 80% of India's population, it remains uncovered by any health insurance scheme. Okay, under the center run Rashtriya Swasthya Bima Abhiyan, only 13% of the rural people and only 12% of the urban population have got access to insurance cover. So you can understand the gravity of the situation over here. There has been a stark rise of out of the pocket expenditure. So whenever you are writing an answer on healthcare or you are giving any data regarding Indian healthcare sector, you have to mention about this problem of out of pocket expenditure. Out of pocket expenditure means people have to go out of their way to spend on health services. Basically इसका ये एक पॉइंट आउट करता है कि हेल्थ सर्विसेज जो होती हैं, लाइक इन यूएसए हेल्थ केयर इज यूनिवर्सल, दैट मीन्स लाइक अ यूनिवर्सल बेसिक इनकम की तरह एक आपको हेल्थ केयर बेनिफिट्स प्रोवाइड किए जाते हैं. दैट डजंट, इट मीन्स दैट whether you are from rural area or from you are urban area, whether you're rich or poor, you have got access to universal healthcare system. उस तरीके का एक सिस्टम इंडिया में भी होना चाहिए, बिकॉज हमारी पॉपुलेशन इतनी ज़्यादा है एंड पॉवर्टी बहुत ज़्यादा है. पॉवर्टी ज़्यादा होने की वजह से एक लोग क्या होते हैं कि दे आर नॉट एबल टू अफोर्ड such expensive healthcare system which is there, because we talked about that the government presence, because government funded जो hospitals होते हैं या government hospitals होते हैं, वहाँ पे तो फिर भी free of cost treatment होता है बहुत लोगों का या BPL families का, बट वहाँ पे जो फैसिलिटीज़ हैं दे आर जस्ट बेसिक हेल्थ केयर फैसिलिटीज़. इफ़ अ पर्सन सफर्स फ्रॉम एनी acute or chronic advanced level disease, then he has to come to the private hospital, and private hospitals charge a lot. They are very expensive. The healthcare costs are simply not affordable by the poor section of the people, and that is why these poor people, whenever they suffer from any kind of chronic disease or कोई भी advanced level का health problem होता है, then they incur out of the pocket expenditure, and that is very bad for their economic situation obviously. So out of the pocket expenditure is a very grave problem in India, and 6.9% in the rural areas and 5.5% in the urban areas. Out of pocket expenditure means it's apart from their consumption needs, उनको अलग से ये पैसा अरेंज करना पड़ता है just to get good health care. So out of pocket expenditure and proportional to multi-ethnic. This has led to an increasing number of households facing catastrophic expenditures due to the health cost. So that is a very bigger problem in the Indian scenario. Okay, now we will continue with some other information or some other data regarding the Indian healthcare sector. Okay, and these data will be related to IMR, that is infant mortality rate, okay, maternal mortality rate, hunger, and other non-communicable diseases. So you have to understand that India has missed achieving the Millennium Development Goals of maternal mortality in India and under 5 child mortality in India. That means that these parameters, we have not performed well in these parameters. Okay, and the rate of decrements in stillbirths and neonatal death cases has been slow. Nutrition status has been very dismal in India, that is, most of our population is not getting enough and efficient nutrition. And one of the causes of child mortality and morbidity in India is poor nutrition status. Okay, global hunger index जो निकाला जाता है, India performs very bad in that, 78th out of 118 developing countries. So this is a very bad performance. ओके, अंडर नरिशमेंट जो है हमारी पॉपुलेशन में बहुत ज़्यादा है. 15% ऑफ आर पॉपुलेशन इज अंडर नरिश्ड. 15% ऑफ चिल्ड्रन अंडर 5 आर वेस्टेड, एंड there is a large proportion of children who are stunted. Stunted means that as proportion to their height, their weight is quite low. Okay, and so all such problems exist in India. Then communicable diseases, they contribute 28% of the entire disease burden. Communicable diseases like जो viral fever हो गया, या like for example जो आपका communicate होता है from one person to another, like viral fever हो गया, ठीक है, and all such other communicable diseases, like for example आपका ये क्या कहते हैं, टाइफॉइड होता है. ये सारी चीज़ें कम्युनिकेबल डिजीजेज है, बिकॉज ये वाटर या और किसी मीडियम के थ्रू स्प्रेड होती हैं. ओके, दैट फॉर्म्स 28%. बट जो नॉन कम्युनिकेबल डिजीजेज हैं, लाइक फॉर एग्जांपल डायबिटीज़ एंड अदर हार्ट डिजीजेज, ये दे फॉर्म 60% of the disease burden in India's case. Okay, and India ironically has to cater to two extreme healthcare situations. One is rising out of exclusions, that is, there are a lot of poor people who have not got proper healthcare facilities, and the other is the lifestyle diseases, like for example diabetes या cardiac related problems होती हैं. तो ये भी बहुत, इनका prevalence भी इंडिया में बहुत ज़्यादा है. India is like one of, I think, second or the first country as far as the burden of diabetes is concerned. like पूरे world में हमारे country में सबसे ज़्यादा diabetes के patients होते हैं, या तो ये एक बहुत एक acute problem है Indian case में. ठीक है, now apart from all that problem, there has been a steady rise in mental illness also in our country. According to recent publication, 1 in every 4 women and 10% men, they suffer from depression in India. And at the same time, progress has been marked in the field of communicable diseases also. That is, you have to consider the positive development also, that polio has been eradicated from our country. Even leprosy ka problem has been curtailed, and HIV/AIDS cases, they have met the MDG target of being reduced by half in number. So as far as these diseases are concerned, polio हो गया, HIV/AIDS हो गया, या leprosy हो गया, उसको कहीं ना कहीं कंट्रोल करने में we have been successful in India. Okay. Now other data which is related to the health workforce means doctors, paramedic staff, nurses, और उन सबको अगर डाटा कंसिडर किया जाए, so India's ratio जो है डॉक्टर का एंड पीपल का, दैट इज जस्ट 7 doctors per 1000 people and 1.5 nurses per 1000 people, which is very dramatically lower than the WHO average of at least 2.5 doctors and nurses per 1000 people. Okay, majority of the healthcare जो workforce है, it is concentrated in the urban areas of our country. So obviously rural areas में फिर workforce उतना strong नहीं है. Obviously that is very bad for the access to healthcare facilities in the rural areas. There's an acute shortage of paramedical and administrative professionals also. That is also one challenge in the healthcare sector. Now, what are the other challenges in the healthcare sector of India? First is obviously the population. Population obviously सारे ही sectors को affect करता है, because of the so much increasing and steadily rising population. It affects all the sectors of the economy and mainly the healthcare sector. Why? Because जितना ज़्यादा population load होगा economy के ऊपर, उतना ज़्यादा लोग ill होंगे, उतना ज़्यादा जो burden है on the already scarce healthcare resources and already scarce hospitals and such other facilities, उनके ऊपर जो burden है hospitals के ऊपर वो ज़्यादा पड़ेगा, because जितनी ज़्यादा population होगी इतने health problems generate होंगे, and especially जो population ज़्यादा है वो बहुत ज़्यादा पुअर सैनिटेशन कंडीशंस में रहते हैं, तो वहाँ पे एक नुकसान होता है easily spread of communicable diseases and all का. So even the living conditions of this highly steadily rising population is very poor, and that further aggravates the problem. Okay, now India has got world's second largest population. Okay, so that is one problem. Then जो health infrastructure है, that is very poor in India. Existing infrastructure is not enough to serve the needs of the growing population. Public healthcare जो institutions होते हैं, or you can say the government hospitals, they are underfinanced and they are even short-staffed. Doctor to patient ratio is very poor in India. Okay, India compares unfavorably with China and US in the number of hospital beds and nurses. Okay, then rural urban disparity बहुत है इंडिया में. Rural India, it accounts for 70% of the population, but it only accounts for 30% of the healthcare services. So there is a huge demand supply gap. ये demand तो है because obviously population ज़्यादा rural areas में ही है, but they have to migrate to urban areas to access good private healthcare facilities, because वो facilities rural areas में नहीं है. Private sector is highly concentrated in urban area, while PHCs are short more than 3000 doctors. So you have to understand that private sector पूरा ही concentrated कहाँ है, urban area में. But PHCs जो basically हमने देखा कि rural areas में normally primary healthcare sectors होते हैं who are only providing basic healthcare facilities. But अगर कोई advanced level का disease हो गया, like for example heart cardiac related problem है, या कोई भी advanced level का आपको disease है, तो उसके लिए आपको अर्बन एरियाज में आना पड़ेगा, बिकॉज मोस्टली जो प्राइवेट सेक्टर है विच इज केटरिंग टू द सेकेंडरी एंड टर्शरी हेल्थ केयर डिमांड्स. एक तो होती है बेसिक हेल्थ केयर, एक होती है सेकेंडरी एंड टर्शरी हेल्थ केयर. लाइक टर्शरी में आपका ये सारी चीज़ें आ जाती हैं, लाइक सर्जरी, liver and heart transplant and such other things, dialysis, etc. So if you require such kind of an advanced tertiary and secondary healthcare facilities, you have to migrate to urban areas, because those facilities are not available to people in the rural areas, whereas most of our population resides in the rural areas. So that is one problem of rural urban disparity. Majority of the healthcare professionals also are concentrated in the urban areas. Then low government spending, public expenditure जो है health पे, that only accounts for 1.2% of the total health expenditure, which is very low compared to the WHO recommendation of at least 5% of health in the expenditure होना चाहिए on health, and which is very poor in India. That is public expenditure की बात हो रही है, not private expenditure, means the amount that at least the government should spend. At present, it's just 1.2%. According to WHO, it should be at least 5%. Okay. Then हाई आउट ऑफ पॉकेट एक्सपेंडिचर की तो हम बात कर चुके हैं. फिर इंश्योरेंस की भी बात कर ली कि 76% ऑफ इंडिया डू नॉट हैव हेल्थ इंश्योरेंस. फिर एक डुअल डिजीज बर्डन की प्रॉब्लम है कि एक तो मैटरनल इन्फेंट मोर्टेलिटी वगैरह का जो रेशियो है इंडिया में वो बहुत हाई है. दैट इज द नंबर मैटरनल मोर्टेलिटी मीन्स दोज केसेस इन विच द मदर लूजेज हर लाइफ इन द प्रोसेस ऑफ गिविंग बर्थ टू अ चाइल्ड. ओके, सो दैट इज मैटरनल मोर्टेलिटी, एंड इन्फेंट मोर्टेलिटी इज जस्ट आफ्टर द बर्थ. If the child loses his life, then that is called as infant mortality. And उसके भी बहुत reasons होते हैं, poor nutrition, poor healthcare costs, जो high healthcare costs हैं private hospitals में, या poor healthcare nutrition जो आपको दिया जाता है. Those are all the reasons why people succumb to such problems. Okay, communicable diseases का जो है burden वो भी है, and उसके साथ साथ जो other lifestyle diseases है like hypertension, diabetes, they are on the rise. So you can say there's a dual disease burden. The situation has been termed as dual disease burden. Malpractices बहुत है healthcare sector में, that is selling of substandard and counterfeit medicines, unnecessary hospital admissions and exploitation. This is one example of the malpractices in the healthcare sector, and it's very bad for the sector as a whole. Adequate attention has not been given to alternative healthcare facilities like homeopathy, Ayurveda या Unani medicines वगैरह. So though people are aware of such facilities also, that homeopathy and Unani and Ayurveda भी होता है, but they are not paying because government has not paid attention to it. So there is no enough investment in these alternative healthcare practices, and that is why also these are not able to grow them in the manner they should have grown. Okay, just give me 1 minute. Now moving forward, we have to tackle this problem of जो भी हमारे health care related problem है. Government has come out with the national health policy. So we will study about what is the problem of, or what are the provisions of this national health policy. So national health policy 2017 जो main objectives हैं वो क्या हैं. to achieve, first of all, universal health coverage. Universal health coverage, that is to ensure availability of free comprehensive primary healthcare services. First of all, जो PHCs हैं आपको उनको empower करना है जो rural areas में हैं. साथ साथ में you have to ensure improved access and affordability, that is all the section of the people poor or rich should at least afford healthcare expenditure. It's not that the प्राइवेट केयर सेक्टर में जो टर्शियरी एंड सेकेंडरी केयर फैसिलिटीज़ अवेलेबल हैं वो इतनी महंगी हों कि जो पुअर है वो उनको एक्सेस ना कर पाए. तो दी scenario or the objective of the national health policy that has been launched by the government in 2017 is to improve access and affordability of healthcare, okay, of quality secondary and tertiary care, achieve a significant reduction in out of the pocket expenditure due to healthcare costs, okay, then to make a predictable, efficient, patient centric, affordable and effective healthcare system, healthy and vital private sector contribution. They obviously, if private sector is playing a major role in the healthcare sector, then government should coordinate with the private care sector, should cooperate with it, and both should work in cooperation with each other to serve the public. Okay, then bring a policy thrust by increasing public investment, coordinate various non-health departments to improve the environment for health, for example linking areas like Swachh Bharat, बैलेंस डाइट प्रमोट करनी चाहिए, यू शुड रिड्यूस स्ट्रेस जो है वर्क प्लेस में. ये सारे क्या है, ये नॉन हेल्थ डिपार्टमेंट्स हैं या नॉन हेल्थ रिलेटेड, मीन्स लाइक स्वच्छ भारत, it promotes cleanliness. It's not directly related to health, but obviously it somehow impacts health. So ये जो areas हैं इनको भी government को अपने approach में link करना चाहिए, and to promote the importance of balanced diet, etc. Incorporating health education. Now health education is very important. Health education would stand for, you know, making people aware of the importance of good health, okay, as part of the curriculum, promoting hygiene and safe health practices within the school environments, also by acting as a site of primary health care and also promoting healthy practices, etc. Organizing public health delivery. So these, through this picture you can understand what are the basic like provisions of this national health policy. So you have to understand that the digital interventions for the nation's health have been promoted in the form of tele-education, tele-CME, tele-consultation and digital libraries के through जो एक national knowledge network है वो उसको encourage करा गया है. See, I'll not go into each detail of national health policy. You can refer to this these slides later and you can go through it comprehensively, but मैं जो mainly जो main provisions है उनके बारे में बात करेंगे. Then preventive and promotive focus बढ़ाना है. You have to bring out behavior change amongst the people, educate and counseling provide करनी है. Interventions from early detection of issues in childhood to prevention of chronic illness पे आपको focus करना है, ठीक है. Then fostering patients focus, quality and assurance based approach रखनी है, ठीक है, हमें एक. उसके बाद यूनिवर्सल इजीली अफोर्डेबल प्राइमरी हेल्थ केयर प्रोवाइड करना है. दैट वुड इंक्लूड प्राइमरी हेल्थ केयर पैकेज, ओके. देन पेलिएटिव एंड रिहेबिलिटेटिव केयर, हेल्थ कार्ड देना है फॉर एक्सेस टू प्राइमरी हेल्थ केयर फैसिलिटी सर्विसेज एनीवेयर एनी टाइम. फ्री ड्रग्स एंड डायग्नोस्टिक्स प्रोवाइड करने हैं अलॉन्ग विद लो कास्ट फार्मेसी चेन्स एक्सेट्रा, ओके, लाइक जन औषधि स्टोर्स वगैरह. दीज आर ऑल पार्ट ऑफ नेशनल हेल्थ पॉलिसी ओनली. बेटर रेगुलेटरी मैकेनिज्म एंड क्वालिटी कंट्रोल करना है आपको, ठीक है. तो ये सारी चीज़ें हैं, इन डिटेल में आप इसके बारे में बाद में भी पढ़ सकते हो. Then to enhance national health programs, okay, utilize the potential of the Ayush Ministry, which is mainly related to promoting Ayurveda and homeopathy and other such जो healthcare sectors होते हैं उनको promote करने के लिए Ayush Ministry बनाई गई है. And government under the national health policy has objectified, or it has made its objective to use the potential of Ayush, okay, improving women health and addressing gender violence. The initiatives like Janani Suraksha Yojana etc. also should be promoted. New norms of addressing domestic violence should be made, family planning program etc. करना चाहिए. Apart from that, tertiary care services should be enhanced, okay. Then what are the other steps that could be taken apart from the national health policy and other such initiatives to strengthen the healthcare system in India? You must focus on increasing life expectancy at birth, because life expectancy जो है इंडिया में वो 67.5 है, but your target should be to at least make it 70, okay. Then reduce the TFR to 2.1 at the national. TFR we talked about in the previous lecture is the total fertility rate, as the average number of children a woman produces in her entire life cycle, so that should be reduced, okay. Then reduce under 5 mortality, that is child mortality, to 23 by 2025, and also MMR reduction. इन्फर्ट मोर्टेलिटी रेट भी करना है, न्यू नेटल मोर्टेलिटी को भी रिड्यूस करना है, ठीक है. Then the other this thing is to achieve and maintain elimination status of leprosy by 2018. That you should target to maintain and eliminate the status of leprosy का जो problem है हमने उसको curtail तो करा है, but you should target to remove and eliminate leprosy, काला आजार and other such things. Achieve and maintain a cure rate of greater than 85% in new sputum positive patients etc. Like for example जो TB वगैरह का prevalence है और उसको एलिमिनेट करने का टारगेट रखना चाहिए बाय 2025. ओके, सो अदर सच थिंग्स टू रिड्यूस प्रीमैच्योर मोर्टेलिटी फ्रॉम कार्डियोवास्कुलर डिजीजेस एक्सेट्रा, ये सब हम लोग गवर्नमेंट को टारगेट करना चाहिए टू वर्क ऑन दीज वेरियस डिजीजेस एंड by setting proper targets, work on removing or eliminating these diseases. Okay, how the other healthcare status must be enhanced. You have to increase health expenditure by the government as a percent of GDP. Okay, and you should make it by at least this. Then ensure availability of paramedics and doctors. Then ensure primary and secondary care facility also in high priority districts. Okay, ensure district level electronic database of information also. Strengthen the health surveillance system, establish registries also. Then you should also focus on primary healthcare. India needs to shift focus from secondary and tertiary to primary healthcare. That is जो PHCs हैं, like for example अगर primary level पे ही आप disease को control कर लोगे तो disease secondary और tertiary level तक पहुँचने की ज़रूरत नहीं है. तो you should also shift more focus to public healthcare centers in the rural areas. And it should be made attractive to doctors by providing incentives and making rural service mandatory for medical students. So that is one way you can encourage the students to work in the PHCs. Then focus should be shifted to preventive healthcare from curative healthcare. कि क्योर करने वाली सिचुएशन नहीं आनी चाहिए, उसको प्रिवेंशन के स्टेज पे ही डिजीज को रोक दो. तो दैट इज वन स्टेप जहाँ पे आप यूनिवर्सल इम्यूनाइजेशन की बात करते हो. बहुत सारे ऐसे डिजीजेज हैं जिसके लिए इम्यूनाइजेशन प्रोवाइड या यू कैन से वैक्सीन प्रोवाइड की जाती है, लाइक पोलियो हो गया एंड डिप्थीरिया हो गया, ये सब चीज़ें. तो उसको प्रिवेंट आपको यूनिवर्सल इम्यूनाइजेशन को और प्रमोट करना चाहिए बिकॉज दैट वुड हेल्प रिड्यूस द इंसिडेंस ऑफ कम्युनिकेबल डिजीजेस एंड रिड्यूस द कॉस्ट ऑफ क्यूरेटिव केयर. Private investment is required in educational institutions. Okay, this would help increase the number of graduating doctors and it would address the problem of doctor to patient ratio. Okay, now we will in the end talk about the national health mission. Now these are some of the you can say main initiatives in the healthcare sector. हम बहुत डिटेल में तो सारे चीज़ों के बारे में बात नहीं कर रहे हैं, बट थोड़े आपको ब्रीफ में एक आइडिया मिल रहा है कि इंडिया में एट प्रेजेंट हेल्थ का स्टेटस क्या है एंड उसको कम्बैट करने के लिए, हेल्थ रिलेटेड प्रॉब्लम्स को टैकल करने के लिए कौन कौन से मेन गवर्नमेंट इनिशिएटिव्स अभी एट प्रेजेंट फंक्शनल हैं. सो नेशनल हेल्थ मिशन इज देयर. इट encompasses two सब मिशंस, नेशनल रूरल हेल्थ मिशन, नेशनल अर्बन हेल्थ मिशन. उसमें मेनली क्या होता है, हेल्थ सिस्टम को स्ट्रेंथन करना है इन रूरल एंड अर्बन एरियाज को. You have to work on the reproductive, maternal, neonatal, child and adolescent health, communicable and non-communicable diseases का prevention करना है. Okay, then the other thing is Pradhan Mantri Swasthya Suraksha Yojana that has got two components to set up new aims and upgradation of government medical colleges. Now the one of the main and the recent scheme that has been launched by the government is the Ayushman Bharat, and it's very important from your prelims and mains perspective both. So you must read about it specifically. Okay, what is Ayushman Bharat? It has got two components, health and wellness centers. Okay, what these centers would do, they would provide comprehensive health care and they are responsible for even providing free essential drugs and diagnostic services. Okay, how this particular Ayushman services, Ayushman Bharat scheme in India would be implemented. At the national level, Ayushman Bharat National Health Protection Mission Agency should be formed. And at the state level, state health agency is formed. Okay, अब इनके तीन मॉडल्स हैं, एक इंश्योरेंस, एक ट्रस्ट मॉडल है, एक मिक्स्ड मॉडल है. फंडिंग का क्या होगा, इट विल बी शेयर्ड बिटवीन सेंटर एंड स्टेट्स. ओके, देन सेंटर विल ट्रांसफर फंड्स थ्रू SHA ओनली, दैट इज स्टेट हेल्थ एजेंसी. ओके, current estimated cost is 12,000 crore. Now quality and cost control, इस यहाँ से पढ़ लेना. इसका ऑब्जेक्टिव क्या है, इट इज टारगेटिंग 6 million families who are sinking into poverty due to catastrophic health expenditure. उनका हेल्थ एक्सपेंडिचर कम हो जाए, इसके लिए इस स्कीम को लॉन्च करा गया है. ठीक है, दैट इज वाई गवर्नमेंट इज स्पेंडिंग सो मच, सो दैट पीपल आर नॉट incurring out of pocket expenditure. उसमें provisions क्या हैं? There would be a 300% rise in inpatient hospitalization that has taken place in the last 10 years because of this scheme, and 80% expenditure is met out of pocket. जो expenditure होता है उसका 80% share cover करता है आयुष्मान भारत स्कीम, ठीक है. Biggest benefit is poverty alleviation only. Now what are challenges for the implementation of this particular scheme? So what are the challenges? First of all is the inadequate health infrastructure. इतना health infrastructure नहीं है कि poor तक जो actually में needy and the poor है उनके तक इस scheme का implementation हो या इस scheme को पहुंचाया जाए, ठीक है. You should roll it out nationally. ये भी एक बहुत बड़ा challenge है. Potential for large scale misuse है. The private hospitals, they might misuse this scheme for their own benefit. Okay, so this is the thing. So this was about your Ayushman Bharat scheme. Main objective is poverty alleviation, and 6 million families are sinking into poverty due to catastrophic health expenditure, and to reduce this, to kind of elevate this problem, this scheme has been launched. Okay, and funding का हमने देखा, it will be shared between center and states. Okay, current estimated cost क्या है, इसका implementation कैसे होगा, through National Health Protection Mission Agency and state level पे state health agency है. तो इस तरीके के इसमें इंश्योरेंस का भी एक स्कोप है, बहुत सारी चीज़ें, ठीक है. अब और डिटेल में भी प्रोविजंस आप इसके बारे में पढ़ सकते हो, बट एटलीस्ट आपको ये तो पता होना चाहिए, ये बेसिक डिटेल्स हैं, ठीक है. द नेक्स्ट टॉपिक ऑफ आवर लेक्चर इज द एजुकेशन सेक्टर इन इंडिया, द एसोसिएटेड प्रॉब्लम्स, रेमेडीज टू इम्प्रूव द एजुकेशन सिनेरियो इन इंडिया, व्हाट इज द इम्पोर्टेंस ऑफ प्रोवाइडिंग क्वालिटी एजुकेशन टू द पीपल ऑफ इंडिया. वो सारी चीज़ें हम अब नेक्स्ट लेक्चर में डिस्कस करेंगे. दिस वॉज ऑल अबाउट योर हेल्थ केयर and the related main schemes. What are the problems? How do we strengthen healthcare system in India? What should be the targets to strengthen the healthcare system? That you have to must focus on increasing the life expectancy, reduce burden of certain communicable and non-communicable diseases. किस तरीके से गवर्नमेंट को अपनी फंडिंग बढ़ानी चाहिए. नेशनल हेल्थ पॉलिसी के बारे में बात करी कि नेशनल हेल्थ पॉलिसी के क्या ऑब्जेक्टिव्स हैं, ठीक है. फिर हमारे चैलेंजेस क्या हैं हेल्थ केयर सेक्टर में. हेल्थ केयर सेक्टर से रिलेटेड जो एक वर्कफोर्स रिलेटेड डाटा है वो भी हमने पढ़ा. फिर तो ये सारी चीज़ों के बारे में हमने पढ़ा, ठीक है. नेक्स्ट लेक्चर में वी विल टेक अप सेम वे में वी विल डिस्कस अबाउट दी problems in the education sector in India and what is the scope for improvement of education sector in India. So that's it for healthcare, guys. Thank you so much.